The number of new coronavirus cases in the United States fell for the 5th straight week. Could this be a turning point in the fight against the global pandemic? Hello, I'm Mike Walter, sitting in for Anna Naidu, and this is The Heat. With about 1,000 people dying from COVID-19 every day, the U.S. still has the worst outbreak in the world, with nearly a quarter of all coronavirus cases. But the number is on the decline, and that could be welcome news for President Trump, who's come under fire for his handling of the pandemic. Let's get straight to our panel. William Haseltine joins us from New York. He is the chair and president of Access Health International and the author of A Family Guide to COVID. With us from Iowa City is Stanley Perlman. He's a professor of microbiology and immunology at the University of Iowa. Georges Benjamin heads the American Public Health Association. He's joining us from right here in Washington, D.C. And also with us is senior news editor at U.S. News and World Report, Joseph Williams, also from Washington. Joe, why don't I start with you? White House Chief Economic Advisor Larry Kudlow spoke to the Republican National Convention earlier this week. Let's listen to what he had to say.
Then came a once-in-100-year pandemic. It was awful. Health and economic impacts were tragic. Hardship and heartbreak were everywhere. But presidential leadership came swiftly and effectively with an extraordinary rescue for health and safety to successfully fight the COVID virus.
Speaking of extraordinary, pandemic in the past tense, that raised a lot of eyebrows, didn't it, Joe?
As it should. I mean, you said so in your intro. Some 1,000 people per day dying of the virus, cases pushing towards 800,000 in the U.S. The number is on the decline, but it's not on the decline fast enough. And when Larry Kudlow made those remarks, he was speaking from his home in Connecticut because the virus has prevented the RNC from actually having their convention in person. So it sort of reminded me of the old vaudeville line, who are you going to believe, me or your lying eyes? And, you know, certainly there are people in states that are still hot zones, Mississippi for one, Arizona for another. You go to any of those states and the virus is very much present. Also, in terms of economic activity, you still have an unemployment rate that's around 9–10%, give or take, in some places, and double that in the minority, almost double that in the minority community, and still a lot of talk about passing another bill that will get economic relief to families that are still suffering. So the Republicans are trying to put a bright spin on this, but the facts pretty much say otherwise.
And Joe, early on in this convention, they didn't really even talk about the pandemic at all. It's only been in the last couple of days. In fact, Vice President Mike Pence also spoke about it. Let's listen to a little bit of his speech as well.
As we speak, we're developing a growing number of treatments known as therapeutics, including convalescent plasma, that are saving lives all across America. Now, last week, Joe Biden said that no miracle is coming. Well, what Joe doesn't seem to understand is that America is a nation of miracles. And I'm proud to report that we're on track to have the world's first safe, effective coronavirus vaccine by the end of this year.
It's interesting because just a few weeks ago, I talked to Dr. Gregory Glenn. He's the president of research and development at Novavax. They've had some very successful trials up to this point, and I was asking him, you know, how quickly can this be out? And he said, we're on hyperdrive here. We could have it maybe early next year. And yet the vice president's saying it could be here at the end of this year. This also raised some eyebrows.
Well, yes, again, for good reason. It's highly likely that any vaccine that will be safe and effective won't come any sooner than early next year. And even if it does, you still are talking about hundreds of thousands, millions of people who actually would need the virus to either prevent getting the vaccine, either to prevent getting coronavirus or protect themselves and their loved ones from getting it. So you'd have to scale up to such a degree that even if you get a successful virus, it's not going to get to the people in enough time before the election, which I think is what they're counting on. And the administration has shown that it is willing to put a rosy face on the truth when the facts, again, speak otherwise.
Let's talk a little bit about the science. William, we've got about 150 vaccines being tested, developed around the world. And as Joe was mentioning, President Trump saying the vaccine could be available before the November election. And yet Dr. Anthony Fauci is trying to tap on the brakes, saying, you know, we do need it. It's an urgent need, of course, but you've got to do this the right way. So give me a sense, realistically, what are we looking at in terms of a timeline, do you think?
Well, let me begin by saying listening to those two speak made my blood boil. It's hard to sit still and listen to such nonsense and outright distortion of the facts. This has not been an administration that has led well. Compare the United States with China. When we have 50,000 people a day infected, which we have, 45 to 50,000 every day over the last month, they have 10 to 15 people infected. When we have 1,200 people die a day, they have none die a day. Their economy is open. My offices are open. People are going to movie theaters and parties and restaurants. That's successful leadership, not the disaster we have here in the United States. And are they hoping for a miracle with a vaccine? They'll need a miracle to solve the mess that we're in. It's terribly disappointing for science, for public health, for this country to be the worst in the world in this pandemic. It did not have to be. Now, with respect to your specific question about a vaccine, we don't know if or when we'll have a safe and effective vaccine. This virus is tricky. We've always suspected, like other coronaviruses, and the other scientist on this panel has actually been my mentor in this, Stanley's been my mentor, is these viruses come back. And now we have increasing numbers of cases, small, but increasing number of cases where people have been reinfected by the same virus. That's a very, very difficult challenge for a vaccine. Whether we can solve the problem, we don't know. So the question is not when we'll have a safe and effective vaccine, it's if.
And Stanley, you're in the research field. I mean, you know how laborious this can be. Give us your sense of what we're looking at.
Yeah, so I think that we will probably have some sort of vaccine in the time frame that Tony Fauci talks about. I think from being on several vaccine committees, I would guess we'll have lots of doses in October and November that may cover healthcare workers and maybe other people who are more susceptible to the infection and need to be vaccinated. But the question is, what are we going to have really in terms of a vaccine? Coronaviruses, as Bill was saying, the ones we know the most about are the ones that cause the common cold, and we know you don't get long-lasting immunity. We also know, though, from the other coronaviruses infections, very severe ones that caused this SARS and MERS in the Middle East, that people who are very sick tended to have better immunity. So putting it all together, I think there's a good possibility that vaccines, if they're not, assuming that they're safe, and this is where one place where people are trying to do the best they can, but things are being done so quickly that we're not really sure we're being able to monitor all the safety that we should. But assuming the vaccines are safe, I think there's a good chance that most people will respond to the vaccine, having immunity that will last for some period of time, may prevent them from getting, or likely will prevent them from getting severe pneumonia, and they may get reinfected, which is what we're seeing, but the people who are reinfected may just have milder disease. I don't know about all the cases that are proven. I know the one in Hong Kong, the person who was reinfected had a second infection that was subclinical or asymptomatic. So if this occurred, then this would be what we might expect from coronaviruses. People are protected from severe disease. They may get a cold or less. The point that I worry about is whether these vaccines will prevent shedding, which is another way of saying transmissibility, because we want people to be protected from not only being sick themselves, but being able to spread the virus to other people who are more susceptible. So where we are with all this, it's such a rush job that it's going to be hard to know where we will end up. Having so many vaccines in one way is good, but in the other way, it's going to be hard for consumers to figure out which vaccine they should get. And it'll be hard for physicians and other healthcare personnel to say one vaccine is better for this group than this other group. And so there's a lot of unknowns here that people are going to try to deal with. I think the speed matters a little, some extent, because I think a lot of us think that no matter what we do, this epidemic or pandemic will be over by the end of 2021. So the more we can do it without putting terrible restraint or constraints on our healthcare system and on decreasing the number of susceptible people in nursing homes and other people with who are not necessarily old but have comorbidities, that's really the goal here.
Let's talk, Stanley, while we're chatting with you about convalescent plasma, because we heard the vice president talking about it. The president has said it's proven to reduce mortality by 35%. Talk to us about it being used with COVID-19 and how effective it is.
Yeah, so it's like so many other things, both in the country and in this infection, it's been so politicized because I think if you look at all the information about convalescent plasma, while there's certainly issues, it probably in total has some good effects. So there's probably at least some number of people who are infected with SARS-CoV-2 who benefit from convalescent plasma. The 35% is a distorted number. That's not correct. The actual reduction is in really specific groups of people. In total, though, it probably has, in fact, thus far the data suggests that it has a good effects. The studies that have been done haven't been controlled properly, which the people who wrote the papers that are being quoted know. So it's not like it's a surprise. So we just don't have enough information yet. There are hints, though, that this is going to be useful for some people if given early enough in the infection and if given with a high enough titer of antibody to the virus. But because of the way it's been politicized, it's become just another one of these issues instead of looking at the science and saying, okay, where are we with this?
Yeah, and Joe, that's also been in the news of late, the politicization of this. The FDA Commissioner, Stephen Hahn, even backtracking a bit. Walk us through this whole process.
Well, basically, the president is looking for a home run here. And he's been leaning on a lot of these entities that usually operate independently and without a lot of interference from the White House. First, you had the CDC. He was pushing them to try to downgrade the numbers. In the CDC, they weren't distributing numbers early on in the pandemic because there were shortfalls, and the numbers that they were getting in states in terms of infections and in terms of fatalities, they didn't match up. So there was a lot of suspicion that the CDC was either fudging the numbers or withholding some of them to make the virus look less severe than it actually was. Then in terms of the virus, vaccination, the president is again talking about how he's got a cure, he's got a home run here, when all the science and all the experts say, well, no, it's almost impossible to create a virus this quickly. As a matter of fact, even talking about having a virus early next year is wildly optimistic and very much beyond what we've ever done before in terms of developing vaccinations for an unknown virus. So then, again, from there, we went on to today talking about how the CDC has kind of rolled back its requirements, or at least they initially had rolled back its requirements, suggesting that if people did not have symptoms, they should not be tested. Again, an attempt that's, a lot of people saw this as an attempt to shave off the virus numbers and make it look better ahead of the election. So politics has been entwined in all of this, mostly because when it came to the time of initial infection, when it swept into the United States, the president said it was going to go away and there was just a handful of cases. He dismissed it for many, many weeks and almost several months before things really got serious. It took a long time for him to wear a mask. Because he hasn't worn a mask, the public modeling that people would expect from a president became politicized as well, where people saw it as a statement. You were either with the president and didn't wear a mask, or you were with science and did, and that caused the infections to continue to climb. So almost at every turn of this virus, instead of getting a grip on things and doing what we need to do and knuckling down, we've had kind of half measures and false promises that have allowed things to continue and allowed us to be far behind countries in terms of where the virus is being reduced.
So, Georges, I want to bring you into the conversation. We're looking at the numbers. The United States numbers, cases down 17% in the last week. That's the fifth straight week where we're seeing declines. I guess that would be a sign of hope and clearly something that the administration would embrace. What do we read into these numbers?
Well, it's really a patchwork of outcomes. You know, you have some parts of the country like Maine and New York, which are doing quite well. You've got Washington State and Oregon, who are doing, you know, just beginning to get their hands around their outbreak. But frankly, you've got these huge burning embers that are occurring in the Midwest, and you have places like Texas and Florida that are still challenged, Mississippi, places like that. So, you know, and then we've got, we're reopening, and we're going to have the Labor Day weekend, and then people go back to school. So we very well might have a recurrence of outbreaks in our country. We just really don't know. This is going to still be a roller coaster for some time to come. I'm hopeful, but we're not there yet.
Roller coaster. Bill, you know, you brought up China and how they've approached this. It's really interesting. You know, you look at some of these countries and how they've been effective at it, and it seems like it boils down to, you know, social distancing, mass testing, contact tracing. And to George's point, I mean, North Carolina State University's chancellor came out today saying a majority of the students are going to have to move out because they're seeing a rapid spread of coronavirus. It seems like almost every day or every couple of days we see this with universities. So give me your sense of what's happening out there.
Well, I think what's happening is that there are two things. One reason that the numbers are coming down is we're testing less. You can track the number of tests we do and the number of people that are positive, and they track pretty closely. So that's a surprise. We should be testing more. We're testing less. If you test less, and the president has said that, you test less, you'll get less cases, and that's what he wants to do. So that's what's happening with some of the numbers. Some of them may be coming down, but let's take a look at Spain. Spain drove their numbers down to about 200 a day. They relaxed, and bingo, it's right back to where it was, about 7,000, 8,000 a day. That is terrible, and that can happen anywhere. It's what happened in the United States. We had reached a plateau, about 20,000 a day. We relaxed, bingo, it went up to 50,000 a day. Those are enormous numbers of people falling ill, and it's maybe not capturing all the people who are infected. So that's a problem. But let me say there's something else at work here, and that is the idea that we should only test people who are ill or worried is what we've actually been doing. And the idea that that's the way we should continue is really got the cart before the horse. What you want to find is people who are contagious. And 90% plus of people who are contagious don't know it. There are beginning to be tests. Abbott just had one approved yesterday that is like a pregnancy test. Now, it's not quite as simple as doing it at home, but soon there will be. We need to find people when they are contagious. It's about a 10-day period when we need to find them and find them quickly and have those people separated from people that they can infect. We need to isolate those people. Find the contagious people. They're the ones without the symptoms. For example, we know that small children have a tremendous amount of virus in their nasal passages. They don't get sick, particularly. Very rarely do they get sick, but they drive infections. People get infected. We need to know where those children are. We need to know where the adults are that are spreading the virus silently. And it's opposite of what the CDC has recommended. Now, I know Bob Redfield very well. We worked together for a number of years on HIV/AIDS. That is not Bob Redfield's recommendation, I guarantee you. It's somebody above him in the administration saying, do this, and he has to do it. So we're doing the wrong approach if we really want. I actually call massive testing a COVID solution with American characteristics.
Oh, interesting. Well, Stanley, let me ask you about the Midwest, because I remember back before Easter Sunday when the President of the United States was saying he wanted to see churches packed on Easter Sunday, and he pointed to some parts of the country, the Midwest, where there really weren't very many cases. And yet, recently we've seen spikes in places like the Dakotas, Illinois, Kansas, Minnesota, Oklahoma, Wyoming, and where you're at in Iowa. Talk to us about that.
Yeah, so we certainly had fewer cases back when the time you were referring to. Part of that was because people in rural areas just weren't exposed to people who were infected at that point. Of course, now things have changed and the virus is everywhere, so people both in rural areas and urban areas in the Midwest are infected. But the states are doing a hodgepodge of different ways of managing the infection because we don't have so much leadership from the top. So in Iowa, we've never shut down. And so we've never had we had a rise sometime in May, but we've never really had a decrease. If anything, we're having more cases now. So, and because of the combination of that we never shut down and we have more cases, we've actually opened up some of the things that some of the bars and restaurants that might facilitate more spread. And in fact, just today, the governor finally shut down the bars again so that this common source for spreading the virus is at least gone temporarily. But it's not, the reason it's increasing is because we never had really strong guidance either from the state or the federal government about doing the right things. And then we opened up way earlier than we were supposed to. You're supposed to open up when you have very few cases and when the number of cases resulting from every positive test is substantially less.
Can I add something to that?
We didn't do that.
Yes, Georges, go ahead.
Well, I think the more important thing, of course, is that's a very important point, but this is not rocket science. We've known how to do this for over 100 years. Testing, contact tracing, isolation, and quarantine has been the centerpiece of disease containment for over 100 years. And it works. It worked in 1918. It worked with any other outbreak that we've had. It works with STDs, sexually transmitted diseases. So this is not something that's new. We've just failed as a nation to implement basic public health measures.
And Georges, we're also still seeing people of color being disproportionately affected by this coronavirus as well, aren't we?
We are. And Native Americans, African Americans, Latinx individuals, even some Asian Americans are disproportionately impacted compared to non-Hispanic whites. And the reason is exposure, public-facing jobs disproportionately, working in meatpacking plants, working out in the fields. They've got to go to work every day. Unlike me, they don't get to telework. Susceptibility, because disproportionately having chronic diseases, more heart disease, more lung disease, more diabetes, and a range of social determinants. What I mean by that is those social factors that either help you get healthy or hurt you from getting healthy. So if you live in a multi-generational home with several people and you get infected, there really isn't a place to go to isolate in that home. And so the rest of the family is going to get infected.
Well, speaking of people of color, they need more people in these vaccine testings, people of color. There's a report out about that as well. Why is that so important, Georges, and why do we not see as many involved in the vaccines?
Well, communities of color have great skepticism for the health system. Obviously the Tuskegee study for African Americans is one issue, but each and every day, the disrespect and the racism that people continue to experience just make people just not trust the system. So yes, we need to get more people into these studies because I would want to know that how these vaccines work on everyone in our country. And so we need to do a lot better job getting people into the studies.
Okay, I'd like to follow up on that.
Sure.
I mean, number one, there is a lot of mistrust in the health care system among African Americans. I mean, but also there is a lot of implicit bias in the medical community. I mean, and in the research community. This is a thing that is not front of mind with a lot of researchers who I've talked with about this. And furthermore, it is the exposure of this virus indicates that we've got a much bigger problem in communities of color than the pandemic. Because it is so disproportionate, because it is so, the numbers are so out of whack. And the leadership here has been really lacking. I mean, I don't mean to call it out, but it's stunning compared to the rest of the country, and it's also stunning compared to what we know that works. And we had a motorcycle rally. We have in Sturgis, South Dakota, cases spiked there. We had Donald Trump giving a rally in Oklahoma. One of his close supporters, Herman Cain, died of COVID-19 from that rally after he was photographed not wearing a mask. And a lot of this has come down to a political climate that's just so confrontational that even basic science is open to question. And I think that the White House tends to encourage that a lot with how they behaved and how they've reacted to this virus.
Yeah. And Herman Cain went back to Atlanta with the virus, and these people in Sturgis fanned out across the country and took the virus with them. Bill, let me ask you about reinfection, because you brought it up earlier, and we do have some sound from Margaret Harris with the World Health Organization. Let's listen to what she has to say.
It's very important to understand what this means in terms of immunity. And this is why we have got a lot of research groups actually tracking people, measuring antibodies, trying to understand how long the immune protection lasts, the natural immune protection. And that should be understood as it is not the same as the immune protection that a vaccine provides.
That study is going to be really important moving forward, isn't it, Bill?
It's going to be very important. But let me just say a couple of things about the reinfection. I think people aren't taking it seriously enough. The cold viruses, as Stanley pointed out time and again, come back and give you a cold. Now, how many people are going to have to be reinfected before we see them get sick? About 1 in 100 people who are infected get really sick. So we don't expect, even on reinfection, if it behaves like it did de novo infection, for many people to get sick. We've only seen 4 or 5 people bona fide reinfected. And it's been a very short time. Remember, they were only infected like 4 months before they got reinfected. So time will tell what is going to happen. But if this virus behaves like the cold viruses, that comes back every year and gets the same people and gives them the same disease, we're going to have COVID for a very long time unless we get a vaccine. Now the question, she said very clearly, is the vaccine immunity going to be different from natural immunity? That's a very serious question. And it pays to pay attention to nature. In 1986, I said, if you pay attention to what's happening in the human body, you will not be optimistic about an HIV vaccine because you make a good immune response and you don't clear the virus.
Interesting.
This is a little different. You make an immune response. I wouldn't say it's a good one, but you make an immune response. You may use that to clear the virus. The virus does decrease, but then it comes back. So whatever you've done doesn't last very long. And does that mean we will have a vaccine? Does that mean we won't have a vaccine? Does it mean a vaccine will last for 1 or 2 months? All of those are questions we don't know the answer to.
Well, we've still
those
got...
are the kinds of things we have to study, and that's why
Unfortunately,
you shouldn't count on anything but public health to control this epidemic. Don't count on a miracle. Count on public health.
We're going to have to leave it there. Thank you all for joining us. Certainly appreciate it. That is it for this edition of The Heat. I'm Mike Walter in Washington, D.C. Thanks so much for watching.